most of my life I had been looking for that X factor that we had always been missing and we needed. And I think when I heard TM and I started learning about it, that's when it started resonating with me. And it resonated even more the more I learned about Maharishi. And pretty soon, it started becoming a part of me that I knew this TM was sacred in a way, and from our perspective, and that it could get us back into sacredness. When I listened to the elders talk and I could understand them, they talked about these two worlds. These two worlds we walk in, and most people think it's the white world and the Indian world, and actually it's the sacred world and the profane world that they spoke of. They talked about us always being born in the sacred and trying to keep centered in the sacred while functioning in the profane world. And about once we go into the sacred, if we're always going in there, then when we come out, we imbue the profane with the sacred. So the sacred is always developing. And that's the way most tribes develop their spiritual lives around that. And I felt that with this transcendental meditation. I've seen transcendental meditation applicable in a lot of areas in our lives. One of the foremost was in our diabetes, and so it was common sense to say that, well, transcendental meditation coupled with a diet, would have an impact on diabetes. I was diagnosed with pre-diabetes a few years ago. I had high blood pressure, and I was taking blood pressure pills. I started meditating, and within a year I came off the high blood pressure medication. Diabetes is ravishing native tribes throughout the United States, and even in the dominant culture, the diabetes is picking up. And I think this study is going to be the forerunner. It's actually going to provide the data that we need in Indian country to look at something that is effective at battling the disease of diabetes. I believe that this is going to show significant results in our diabetic people. It's going to show results in their reduction of stress, which is going to help their diabetes. But it's also going to open it up to all of Indian country. All of Indian country. And once Indian country begins to meditate, if they're just using it for diabetes, they're going to find that this is affecting all areas of their life. In 2006, one of the TM teachers called me and said that the David Lynch Foundation had awarded a scholarship to Winnebago, and that we could start teaching TM from 6th to 12th grade. To me, the most important thing that transcendental meditation does is it reduces significantly our stress levels. And just think what our kids go through. If there's still alcoholism prevalent here, a lot of our kids come to school not rested and not with the proper diet, and they're tired, and the first thing they're going to do is put their head on their desk, and they're going to sleep, and they're not going to hear what's being taught to them. And so I've seen transcendental meditation as also offering not only stress reduction, but some rest for them.
Diabetes is a really devastating disease for the native population. Uh, I encounter lots of diabetic patients in North Dakota, and also when I moved to Winnebago, Nebraska, we've seen a significant number of diabetes. You can say 80% of our population are diabetic. I do believe that stress is a precipitating factor for losing our battle with diabetes. Diet-wise, we're doing our best. We're controlling the diet. We have several dietitians. We make sure that the patient get the information they need to do with their diet. We also using all the standard medications. We having regular visits for our patients. We having podiatrist service to take care of their food. Even so, we still having problem to control the diabetes. It has to be another factor, especially the stress. I believe that Transcendental Meditation will have an impact on the short term for controlling diabetes and also for the long term. Patients that we see in our clinic that went through the Transcendental Meditation program, they do act totally different than the patients that never went through the program. When they come to see in the hospital, their blood pressure is much lower than other patients, and that's stemming from the low level of stress they have. They speak softly, they are aware of their labs, their disease, they interact better with the provider, and they're willing to be part of the solution. We hope that by doing this study that we will use it to benefit our local native populations, and we would like this will be a starting point for us to move from locally to Winnebago area to involve the whole Indian population in the country. I am sure that the studies will help us to improve diabetes and to control diabetes and decrease the incidence of developing diabetes in this country.